my name is Pauline Isabel Isanteno from BSN 2A, and today we will now performing Fundic height measurement and Leopolds maneuver. So Fundic height measurement, or McDonald's rule, is a measurement of the size of the uterus used to assess to know the fetal growth. Is measured on the top of the mother's uterus to the top of the pubis symphysis. On the other hand, Leopolds maneuver is a systematic way to determine the position of the fetus inside the woman's uterus. Leopolds maneuver consists of abdominal examination divided into 4 palpation of the uterus and the fetus. So the materials needed is the tape measure, the notepad and pen, the stethoscope, so our watch and our drip. So for assessment, we will now review the client's record of the last menstrual period and prenatal visit. So we will now interview the patient first about her LMP. So for example, the client response to her LMP is on June 24, 2020. So we will compute the age of gestation of the mother. So upon computing, we get 30 weeks and 6 days of age of gestation. And we can say that the mother is 7.5 months pregnant as of January 26, 2021. So for example, the last clinical check-up of her is on last December 23. So we will now compare it to our result and see if there is any physical changes in the mother and to her pregnancy. So we can also ask her, "Mom, how is your pregnancy going? So how are you feeling today?" Okay, Mom. It is your first pregnancy. So, do you feel depressed or helpless? So, asking some questions is also important to get the baseline data. Next one, we will now gather the materials needed. So, this is to save time and effort. And next one is our planning. So we will now identify the patient and explain the procedure to the patient. We will now identify the patient. So using the ID band, or ask the patient directly. So Mom, that is your name. Okay, Mom. Thank you. So we will now explain the procedure to the client to lessen the anxiety and gain cooperation. So, hi Ma'am. So today I will now performing Fundic height measurement and Leopolds maneuver. And I will also get the fetal heart rate of your fetus. So is it okay, Ma'am? Okay, Ma'am. So then we will now perform hand hygiene. So we will now perform hand hygiene using soap and water, and we can also use alcohol as an alternative. So this is to avoid transmission of harmful germs and prevent further infections. And then we will now close the room door or curtains. in order to provide privacy, because the client will expose her abdominal area. We will now place the bed on appropriate height and comfortable working position. So, it's all in order to do properly the procedure and to avoid the likelihood of injury to the patient. So, we will now also ask the patient to empty her bladder. So, we can ask the patient to pee on the restroom because full bladder displaces the uterus, causing inaccurate measurement. So, we will now proceed in implementation. So, we will now position the client in dorsal recumbent. So, in dorsal recumbent, so the patient lies on the back with the lower extremities moderately flexed. So, it is to provide maternal comfort and better result, and to relax abdominal muscle of the patient. So, we will now drape the client using our blanket. So, we will now cover the client with blanket from the waist on the lower extremities to provide further privacy, and we will now expose the abdomen of the client carefully, so avoid exposing the genitalia and the breast of the client. And make sure that the room is not too cold or for the client. So here, and we will now warm our hands by rubbing one against the other before placing on the abdomen. So cold hands may stimulate uterine contraction, making it hard to perform our assessment. So next one, we will now observe the woman's abdomen, as which the longest diameter and whereas the fetal movement is apparent. So as you can see, the longest diameter is on the midline of the abdomen. So we must take note of it because some cases there is a baby in transverse position. So next one, we will now measure the distance of abdomen of the patient from the top of the pubic symphysis over the curve of the abdomen to the top of the uterine fundus to determine the height of the pregnant patient. So it also determines the age of gestation. So it is used also to know the fetal growth and the EDD. And using our measuring tape here, so we will now measure the fundic height using our centimeters. So from the top of the fundus to the pubic symphysis. So as we observe, the fundic height is 30 centimeter, so which is exactly AOG, or the age of gestation we computed. So it's 30 weeks. So it is okay for 30 centimeters. So we will now proceed for Leopolds maneuver. So the purpose of assessing this one is to determine the fetal presentation, position, engagement, and station. So this is to locate and assess fetal heart tone, and to monitor the fetal growth, movement during pregnancy. So we need is our stethoscope here. So the palpation can be sometimes uncomfortable for the patient. So we must ensure that the patient is relaxed and in proper position. So we must ensure that the woman has emptied her bladder. So if not, she may have straight urinary catheter. So, or she can micturate by herself. And then the patient must lie on the back, so with her shoulders. So raise slightly on the pillow and her knees drop on a little. So still, so covered with our drape. We also need to warm our hands first to provide comfort in palpation. So we will now proceed on the first maneuver or the Fundic grip. So facing the client head part, so we will now palpate the fundus with both hands here and observe the shape, consistency, and mobility. So we will now palpate the upper abdomen with our both hands. So as we palpate, so I feel soft and globular shape here, which is the buttocks of the fetus. So we can say that the fetus is in cephalic position. And then if we feel any firm or hard found and move separately from the trunk or the body, that indicates the head. So we can say that the fetus is in bridge position. So next one is the second maneuver. It's also known as lateral palpation or umbilical grip. So this maneuver locates the fetal back. So here, so still facing the client's head part. So we will now place our left hand here, stationary on the right side of the uterus, to immobilize it here. So we will now palpate the left side of the uterus from the top to the bottom with our right hand. So we will now apply gentle but deep pressure and able to determine what lies on the either of the side of the fetus. So we will now take note. So as we feel, so I feel here is the back of the fetus, which is smooth and hard and has a resistant surface. So we must take note of it here. So because this is the best site for fetal heart tone. And then repeat the procedure on the other side of the uterus. So placing our right hand on the one side of the abdomen and using our left hand. So we will now apply a deep pressure. So as I feel there is an angular bumps unlike here. So and small irregularities which indicates the extremities of the fetus. So next one is the third maneuver. So it also known as the Pelvic Grip. So this maneuver determines the engagement of the presenting part. So still facing our client, the head part, we will now grasp the lower abdomen here above the symphysis pubis. So with the hand near on the mother legs here, this is the legs. So using our thumb and fingers. So we will now use thumb and fingers on the right hand to grasp the lower abdomen area located above the pubic symphysis. So as we palpate it, the presenting part with the head of our fetus since it in cephalic position, so it moves upward, so that our fingers can be pressed together here like this one. So we can say that the fetus engagement is not yet engaged, so or called floating. So if the presenting part here is no longer movable and our fingers doesn't meet each other, so we can say that it is engaged. So the baby is often engaged 2 weeks before the birth, approximately 38 weeks of gestation. So we will now proceed in fourth maneuver, so which is the pelvic grip. So this step should be done while facing the client feet. So we will now turn on the other side, and then this process involves locating the fetus brow, which determines the fetal attitude and degree of fetal extension of the presentation is cephalic. And then so we must take note. So it must be flexed on the extremities and extended if the brow is on the same side of the back. So we will now facing the client foot part. So we will now place first 3 fingers on both sides of the lower uterus. So above 2 inches above the inguinal groin. So we will now press downward. So downward but inward. So in the direction of the birth canal. And we must note the 1 fingers must not meet obstruction and glide over the nape of the baby's neck. So here. So the other is obstruction, which is the brow of the baby. So as we palpate, so my left hand meet no obstruction here, which indicates the nape of the fetus. So there is no obstruction here. So on the other hand, on my right hand, feels bumps and obstruction, so that indicates the brow of the baby or the forehead. So next one, we will now auscultate the fetal heart tone. So we must remember the fetal back. So from the second maneuver, so the fetal back is in here on the left lower quadrant of the patient. So here on this side, since this is the side of the fetal back, so we will now place our stethoscope and open this, and then we will now warm up the bell part of our stethoscope. So we will now count for the whole 1 minute here by comparing the mother pulse. So we will start. So we are now done. So as we count for the whole 1 minute, so I get 125 beats per minute, which is normal. So since the normal range of the fetal heart tone is 120 to 160. So after getting the fetal heart tone, so we will now relay the result to the mother. So we'll put it in our notepad, and we will now relay it to the mother. So mom, so the fetal heart rate of your baby is 125 beats per minute, and don't worry, it may be fast for an adult, but it is just a normal for the fetus. So, and then after that, we will now place the patient in comfortable position. So, we will now get back our client in supine position and return her clothes appropriately. So for evaluation, we will now evaluate the client comfort and patient response to our procedure. I can ask the patient, so how are you feeling, ma'am, after the procedure? Do you feel any pain upon palpating your abdomen? So do you feel any do you have any pregnancy concern aside from this procedure? And then we will now document. So we will now record all the findings correctly and interpret and relay the findings to the mother. So as we finish the procedure, we can relay the result to the mother. So hello ma'am, so I will just discuss the findings. So your fetus is about 30 weeks and 6 days. So you are now in your 7th month and a half month pregnant. So you are now in your third trimester of your pregnancy. So the Fundic height of your baby is 30 centimeters, so which is normal to your age of gestation. And so your baby is now growing rapidly since she is preparing for delivery. So your baby in cephalic position, meaning the baby head part is pointing at the birth canal. So this position, mom, is considered as the best for delivery because it is easiest for the head to come out smoothly as you give birth. So mom, so I will just report the heart rate of our baby. So it is 125 beats per minute, and then which is normal. So the fetus engagement is not yet engaged, so it's still floating. So, however, mom, in your last week of pregnancy, so the baby's head can move downward in your pelvis, which is called the engagement of the fetus. So, for the preparation of your delivery. So, the engagement only happened only in last week of your pregnancy, where is the largest part of the head has entered the pelvis. So, mom, so just follow your prenatal checkup every 2 to 4 weeks as appointed by your doctor. So, it depends on your pregnancy history. So, starting at 36 weeks, you need prenatal checkup weekly until your delivery. So, just eat proper nutritious food and avoid being stressed. So, thank you, mom. So, this documentation provides coordination of care to the patient. So, that's all. Thank you po.